Imagine this, a quiet morning in suburban Ohio. James, 68, retired early, eats clean, exercises daily, doesn't smoke, keeps his blood pressure in check, collapses, suddenly, while watering the lawn. No chest pain, no warnings, no history of heart disease. His wife, Anna, watches in shock as the ambulance arrives, not knowing what just happened. James had said the night before, "I feel fine, no reason to worry." He never came back. This isn't rare. According to the CDC, every 40 seconds, someone in the US has a heart attack. Worse, nearly half of those people had no clear warning signs at all. No pain, no shortness of breath, no red flags. So what is the real reason of heart attack? Is it high cholesterol, family history, or something silently building up inside you without symptoms until it's too late? In this video, we're going to unpack the truth most headlines leave out. We'll talk about plaque instability, silent risks, and how a small aspirin pill could be the difference between life and death, but only if used wisely. If you've ever been confused about whether to stop or continue aspirin, if you've ever thought, "I'm healthy, I don't need to worry," then stay with me, because what you're about to learn could help you or someone you love prevent that first heart attack or stroke. And as we'll see, for many, that first one is often the last. Most people think heart attacks are caused by arteries slowly clogging up like grease in a kitchen pipe. That's only half the truth. The real danger isn't how narrow your arteries are, it's how unstable your plaque is. When a small, hidden plaque ruptures, your body reacts like it would to a cut. It forms a blood clot to seal the wound. But inside an artery, that clot becomes a ticking bomb, blocking blood flow to your heart or brain within minutes. That's not a slow process. That's sudden death in silence. According to the American Heart Association, up to 50% of people who die from heart attacks never experienced any prior symptoms. And when it comes to strokes, 1 in 4 survivors will have another stroke unless preventative measures are taken. Now, here's where it gets even more dangerous. Many symptoms in women go completely unnoticed. Fatigue, indigestion, sleep disturbance, anxiety. These don't look like classic signs, yet they're often the only clues to an upcoming heart attack in women. Some even mistake mini strokes, called TIAs, transient ischemic attacks, for just being tired or a weird moment. But they're often the only warning your body will give before a major stroke. So how can you tell if you're at risk? Start by listening to the signs your body whispers before it screams. These are 7 early warning symptoms that may appear up to a month before a heart attack. Unusual fatigue, shortness of breath, sleep disturbances, chest comfort, indigestion or nausea, anxiety, sweating without exertion. It's not about panic, it's about awareness. Because feeling fine is not a diagnosis, it's a delay. And for many, that delay becomes irreversible. Now that you know the hidden danger, the next question is, how do we protect ourselves wisely and personally? That's where aspirin enters, not as a universal answer, but as a possible life-saving ally. Let's look at the truth behind this tiny but powerful pill.
It's a tiny pill, but it comes with a big question. For decades, aspirin was praised as a wonder drug, a low-dose, daily habit that seemed to promise a layer of protection against the most feared conditions, heart attacks and strokes. It was affordable, accessible, familiar, and for many, it became part of their morning routine, right alongside the coffee and the crossword puzzle. But then the headlines started to change. Studies emerged. Guidelines shifted. Suddenly, what once seemed like solid ground turned shaky. And the truth? It's more nuanced than most people realize. Let's first understand what aspirin actually does. Contrary to what many believe, aspirin doesn't dissolve cholesterol or clear out blockages in your arteries. It works in a quieter but crucial way. It reduces how sticky your platelets are. These platelets are the parts of your blood that clump together to form clots. In the right situation, that's life-saving, like when you get a cut. But inside an artery, that same clotting process can be fatal. If a small plaque inside your artery wall ruptures, your body reacts by forming a clot to seal it. If that clot blocks the artery entirely, blood flow stops and a heart attack or stroke begins. Aspirin makes those platelets less eager to pile up. That's how it reduces the chance of that fatal blockage forming at the worst possible moment. Now, here's where things get specific and personal. If you've had a heart attack, a stroke, a stent placed, or been diagnosed with plaque buildup or atherosclerosis, you're in a category known as secondary prevention. You're not in the general population. You're someone whose arteries have already shown signs of instability. And in that case, aspirin is not just useful, it's proven. According to the U.S. Preventative Services Task Force and data published in the New England Journal of Medicine, aspirin can lower the risk of a second cardiovascular event by up to 25 to 30%. That's not a theory, that's a clinically demonstrated fact. But if you've never had a cardiovascular event, if you're otherwise healthy, over 60, and have no evidence of plaque, then the equation changes. In these cases, aspirin's benefit becomes far less certain, and the risk, it increases with age. The most serious is gastrointestinal bleeding, which can happen without warning. In fact, studies show that for adults over 70, the risk of major bleeding events can outweigh any preventative benefit aspirin might offer. That's why in 2022, the U.S. Preventative Services Task Force formally recommended against starting aspirin for primary prevention in adults aged 60 and older, unless clearly justified by individual risk profiles. And here's something most people don't hear often enough. If you're already taking aspirin and you're not sure whether you still need it, don't stop abruptly. Stopping aspirin without medical supervision can trigger what's known as rebound clotting. It's like pulling away a dam that's been holding back pressure. There's evidence to suggest that within days of sudden discontinuation, the risk of a heart attack or stroke can temporarily spike. So if there's one takeaway, let it be this: never make that decision alone. What does all this mean for you? It means the question isn't simply, should I take aspirin? It's, why am I taking aspirin? And is that reason still valid today based on what we now know about my body, my history, and my risk? The answer lies not in fear nor in trends, but in clarity. And that clarity begins with you, your story, and a conversation with your doctor, armed with the right knowledge and the right questions. Because aspirin isn't good or bad, it's powerful. And like anything powerful, it must be used with purpose. So far, we've talked about the power of aspirin, when it can protect you and when it might harm. But here's the truth that bridges everything we've said. Aspirin should never be a guess. It should be a response to real, personal risk. And here's the hard part. Most people don't actually know their real risk. They go by how they feel. I eat healthy, I walk every morning, I feel fine. But feeling fine isn't a diagnosis. It's not a shield. Plaque doesn't cause pain. It builds in silence. And sometimes the first symptom is the heart attack itself. That's why nearly half of all fatal heart attacks occur in people who never had warning signs before. People who said exactly what you may be saying now. I thought I was okay. So how do you find out if you're truly at risk? It starts with 3 powerful tools. The first is a coronary artery calcium scan. It's a simple, non-invasive CT scan that measures calcium deposits in your heart's arteries. A score of 0 means low risk. A score over 100, that's a red flag. According to research published in JAMA Cardiology, people with a CAC score over 300 have a 5-fold increase in heart attack risk over 10 years, even if their cholesterol looks normal. Second, there's the carotid ultrasound, which checks for plaque and thickening in the arteries leading to your brain. If soft plaque is present, even without symptoms, that's vascular disease. Full stop. Third, your inflammatory and metabolic markers tell a deeper story. high-sensitivity C-reactive protein, CRP, hemoglobin A1C, fasting insulin, these markers reveal whether your internal environment is quietly pushing you toward plaque instability. Inflammation is what makes soft plaque rupture. It's not just about what's there, but what makes it dangerous. Here's the most eye-opening part. Two people can have identical cholesterol levels, but one has stable, calcified plaque and lives another 20 years. The other has soft, inflamed plaque and suffers a fatal heart attack at 64. The numbers only tell part of the story. The structure, location, and behavior of your plaque tell the rest. So if you've never had a CAC scan, never looked deeper than your cholesterol, maybe it's time. Not because something is wrong, but because you deserve to know what's right. You deserve to replace assumption with information and fear with clarity. Continuing from understanding your real risk, let's explore how your daily choices can protect your heart more reliably than any pill, including aspirin. This is where true empowerment begins. First, let's talk about diet. Research consistently shows that eating patterns like the DASH diet, the Mediterranean diet, and a whole foods approach can reduce heart attack and stroke risks by 20 to 30% compared to typical Western diets. These diets emphasize fruits, vegetables, whole grains, fish, and healthy fats, and minimize processed foods, red meat, and added sugar. Specifically, berries are rich in antioxidants that help protect blood vessels. Leafy greens support endothelial function. Oily fish like salmon bring anti-inflammatory omega-3s. Oats help lower cholesterol, and olive oil provides heart-healthy monounsaturated fats. When combined, these foods create a powerful diet known to lower blood pressure and reduce stroke risk. If you've ever wondered what to eat to prevent stroke, high blood pressure, or heart attack, this is it. But diet is just one piece. Consistent movement matters too. Just 30 minutes of brisk walking a day can cut heart attack risk by up to 36%, improve cholesterol balance, strengthen your blood vessels, and reduce stress hormones. For older adults, walking is safe, low impact, and easy to fit into daily life. Pair it with good sleep, aiming for 7 to 8 hours nightly, and stress management strategies like deep breathing or light yoga, and you're reinforcing your heart's resilience from every angle. Supplements can complement, but never replace these foundational habits. The most well-supported supplements include marine omega-3s, which have been shown to reduce heart attack risk by around 15%, Q10, which supports mitochondrial health, magnesium, essential for regulating heart rhythm and blood pressure, and vitamins D3 and K2, which support bone and vascular health. But take care, these can interact with aspirin or blood thinners, increasing bleeding risk. That's why it's crucial to consult your doctor before adding supplements, especially if you're already on aspirin. Here's the expert tip worth your attention. Start small, stay consistent. You don't need to overhaul your lifestyle overnight. Add berries to your cereal. Take a 10-minute walk after lunch. Replace soda with water infused with fruit. Sleep with a consistent bedtime. These daily habits, repeated over weeks and months, build up to real change. It might seem like a gentle approach, but behind every small step is a powerful ripple effect. Over 6 months, a modest combination of diet, movement, sleep, and stress reduction can lower blood pressure by 10 to 15 points, reduce LDL cholesterol significantly, and even reduce inflammatory markers like CRP. Those changes strengthen your heart, making it less vulnerable if plaque ever ruptures. Remember, the greatest investment you can make in your health doesn't come from a pill bottle. It comes from the choices you repeat every day with care, kindness, and consistency. Your body remembers, preserving your vitality, your clarity, and your freedom.
Let's take a breath and bring everything together. Aspirin is powerful, but like all powerful tools, it isn't safe for everyone, and it isn't harmful to everyone. It's not about being for or against it. It's about understanding when it helps and when it doesn't. That's where your compass comes in, not to point north or south, but to point you back to yourself, your risks, and your choices. So here it is, the Senior Compass. 5 clear directions to help you navigate your health with confidence, not confusion. First, know your real risk. Don't go by age alone or how you feel today. Get tested. A CAC scan, a carotid ultrasound, blood work for inflammation and insulin resistance. These tools exist so you don't have to guess. Use them. Second, eat to protect your heart. Not perfectly, just consistently. Choose foods that reduce inflammation, support your arteries, and energize your life. Berries, greens, whole grains, fish, olive oil. What nourishes your body also calms your system. Third, move every day. Not to punish yourself, but to remind your body that you still trust it. A daily walk is medicine. So is good sleep. So is laughing. Movement is proof you're still here and still capable. Fourth, talk to your doctor. Not with fear, but with facts. Bring your test results. Bring your questions. Make your appointments count. You deserve care that's personal, not generic. And finally, use aspirin only if it matches your profile. Not because the news said to start it, not because a friend told you to stop it. Use it because it makes sense for you right now, backed by evidence. You may be over 60, but your body still listens. And if you give it a plan rooted in clarity, care, and consistency, it just might give you something incredible in return. Not just more years, but better ones. Now take a moment, breathe, and know this. It's never too late to start listening to your heart, quietly, wisely, and bravely. Finally, please remember that the information in this video is for educational and inspirational purposes. To get medical advice that is best suited for your individual health condition, especially if you have underlying medical issues or are taking medication, please always consult with your doctor or a qualified healthcare professional.